And welcome back. For the first time, your genes could now tell if you're at risk for opioid addiction.
The FDA has approved the testing a few weeks ago and is joining us now. It is Friday. It is Friday. Dr. Payal Kohli here with some information about the idea of testing, like your genetics kind of offering a clue as whether you may or may not be more susceptible to this. So it's basically testing for your addiction risk? Is that what this is?
Right. Yeah. That's exactly right. So this is the FDA saying we are going to get ahead of the opioid use crisis because for too long we have been doing damage control. We have over 2 million Americans. We lose 120,000 people every year worldwide to opioid addiction. So why wait for them to get addicted and then do this? Instead, we have the tools now to predict, based on a genetic test, a DNA test, who has risk for more addictive potential to this medication class.
So the idea here is to let someone know, say, hey, if you have these genes in you that are going to make you more susceptible to addiction, be careful when you ask for this type of medication at the doctor's office.
Right, so this is a test for doctors as much as patients. When, for example, you go for an elective surgery, and these are for people 18 and above who are maybe using opioid medicines for 4 to 30 days. So someone who has a short-term kind of reason to use it like a surgery. Do the test if you've never taken opioids. This is not for patients with chronic pain. And if you have addictive potential, if these genes are there in you, then the doctors really need to pick something else to treat your pain.
Very interesting.
How does this work? Is this a blood test?
No, it's a DNA test. So they swab the inside of your cheek. And the way that it's set up, it's designed to be done in the doctor's office only. So you need a prescription to do it. And that's intentional by design by the FDA because they don't want you to be doing this at home and making decisions on your own because it's really a complicated decision, right? It's not a dichotomous yes or no. It's part of a bigger decision of what type of pain you're going to have, how long you're going to have the pain, what the reasons are. But the doctor swabs your cheek, they do a DNA test, and they can tell you what your risk for addictive potential is.
I don't think I knew that addiction risk would live in your DNA, that could tell you, like what's in there that's telling somebody that?
It's a whole cluster of different genes that determine our behaviors. Now, as you allude to, it's not just our genes, it's also our behaviors, right? It's our environment, it's the people that we spend time with. So it's a very complicated thing. But if you're a setup to have addictions, and you can imagine this is opioid addiction that we're talking about today, but in the future, this could be applied to alcohol addiction or smoking addiction or many of the other behaviors that we talk about that can be very addictive.
This is a DNA test. I'd imagine it's like a cheek swab or something like that, so there's probably no risk or no pain associated with it.
Well, it's interesting. There are some risks because no test is 100% accurate, right? So the risks are really the false positives and the false negatives. So if you get a false positive test, you could potentially not be someone who's at risk for addiction, but the test tells you you are. You essentially might be closing the door on a class of medications that's one of the most potent class of medicines. If you get a false negative test, there are two ways in which it could impact. One is, of course, the test was wrong. You have addictive potential, but you got a negative result. The other is it could psychologically alter your behavior, right? If you get a test that tells you you're not at risk for addiction to opioids, maybe you'll take more than before. So that could also impact your behavior, which could then have physiologic consequences.
Almost kind of like the placebo effect. The placebo effect is such a powerful effect, and this kind of like maybe parallels that a little bit, what you're talking about there.
Exactly. We talk about the placebo and we talk about the nocebo. If I tell you something bad is going to happen to you with a drug or could happen to you, this happens with statins all the time. You could get muscle aches. You'll feel those muscle aches, even if I give you a sugar pill. So it's very interesting how our brain and our physiology are very closely tied together.
And how many people have we heard over the years who begin an opioid addiction because of something as simple as a surgery and the medication after?
And it's a slippery slope. And this is why I think this is a landmark decision for two reasons. One, the opioid use crisis, as we've been discussing. But the other, this is the era of personalized medicine, right? We're no longer doing a one-size-fits-all, here's a cookie-cutter approach. We are looking at your DNA. We're designing a pharmacologic medication regimen specific to your DNA. And I think it opens the door for us to do this all disease states and all kinds of conditions.
Very interesting. Thank you, Dr. Kohli, for being here.